Welcome back to Empowered. I'm Elizabeth Namovsky. On today's episode, we're discussing brain aging and inflammation. Jasmina, I wanted to talk to you about chemo brain because I've heard that term often. What exactly is it?
Chemo brain is also a relatively new term. It is associated with receiving of chemotherapy. So after or prior to surgery, usually patients that have cancers receive chemotherapy. This chemotherapy is associated with a lot of adverse effects. We know that most people lose their hair, they lose the power, sometimes they vomit, and they lose weight. And also their brain, unfortunately, enters a state of lower function. So this is a set of neurological and also psychological symptoms that are associated with receiving chemotherapy. Among these neurological symptoms, usually the patients report deficits in memory, in executive functions, in attention, concentration, which actually makes their everyday life a bit hard. Also, there is a set of psychological symptoms such as depression, anxiety that is associated both with the prognosis, with the cancer treatment, but also with the physical stress that their bodies are going through.
So if you've got chemo brain, is that long-term, or once you stop chemo, your brain functions go back to normal within time?
Usually your brain functions go back to normal or close to normal within time. They say that it's maybe twice or three times the length of the receiving chemotherapy. So twice or three times more you need to recover from chemotherapy. However, some patients report that their brain function never went back to normal, and it's also individually dependent.
So is there any imaging that can detect changes in your brain?
That is actually what I've been doing for 10 years. I do the magnetic resonance imaging of the brain with advanced methods. There are several advanced methods that can be used. One of them is volumetry. So we measure specific volumes inside the brain. I was talking about the limbic system that is affected by inflammaging and brain aging in both settings. So we can measure small volumes of small structures inside our brains, compare it with healthy controls or with this person but prior to chemotherapy, and see whether the volume is changing. It can go up, so it can raise, and also it can go down with receiving of the chemotherapy. The other technique is called MR spectroscopy. It is a technique where we measure the neurometabolite concentrations in small volumes. So with these measurements, we can say that the brain is entering the state of inflammation or neurodegeneration, and we can see more about this subtle differences inside our small volumes, so even smaller particles than with volumetry. And the third technique, which I'm also excited very much with, is tractography. It can reflect the white matter integrity and the function of our fiber tract. So we can measure actually the neurotransmission indirectly in our brains. So these are the three techniques that I usually use. There is one more, it's called functional MRI, and it has something to do with neurovascular reactivity. So if we, for example, move our leg, then the neurovascular activity in our motor center will change. So we can say this is the motor center and the activity is raised. The same thing can be done for sensory functions or with visual functions and many others in our brain.
So are there any neurocognitive tests that can accurately detect these changes for let's say, women?
We are still trying to set the right combination of neurocognitive tests that can give us a whole picture of the neurocognitive decline in the chemo brain and also in other kinds of inflammaging, of accelerated brain aging, because we need tests that will cover both the cognitive part of brain functions and also this psychological part. So we need the combination of the tests that can say this person has decline in, for example, concentration, attention, but also the symptoms of anxiety, which is also something that will let's say exhort our brain, that will make it function with a lot of stress and that will enter the phase of inflammaging and accelerated brain aging.
Okay, so when we come back, we're going to talk a little bit more about brain aging, inflammation, and just basically brain changes as we get older. So please don't go away.